Hello, my name is Mary Aschliman, and I am a student at Moraine Park Technical College in the Registered Health Information Technician program. I have worked in healthcare for 24 years in various departments. I can say I truly have a passion for healthcare. Today I'm here to talk to you about the difference between an electronic medical record and a paper chart. I am currently a certified medical coder at Upland Hills Health, so I certainly have many chances of viewing patients' medical records, and I believe that the patient has a right to know about their private healthcare information. When you go to the doctor for care, do you ever wonder what happens to that big paper chart that the doctor brings into the room when they're there to see you? Today, I'm going to give you some ideas of what happens with that big chart after you leave the doctor's appointment. As you can see by the screen, I've taken several pictures of medical records, and as you can see, it's probably not what you have pictured. I am here today to talk to you about the advantages of a medical record and how it's changed through the years. Our world is now being transformed by electronics, whether it's smartphones, tablets, web devices, etc. Our world has changed back from even 10 years ago. A flow of information within a digital healthcare infrastructure is created by having an electronic medical record. An electronic medical record can transform the way healthcare is delivered and compensated. With an electronic medical record, information is available whenever and wherever you need it. Currently at Upland Hills Health, we have Epic, which is a big electronic medical record. So if a patient is seen in our emergency department and they're transferred to St. Mary's that also has Epic, the doctor at St. Mary's can log in and view the patient information. So if there's a transfer of that patient, the doctor in Madison is already expecting that patient and they know about that patient, so they can give them the best care from the minute they walk into the door. Let me show you some advantages from a physician's standpoint. They can give a more improved diagnosis and treatment because everything is right there in the chart. They can view the lab results upon seeing them right away. The x-ray is right there, and it could be a matter of a click of a mouse. There's significantly fewer errors found in electronic medical record compared to a paper chart. And the physicians can give faster care and better decision-making when treating their patients. As you can see by this chart, this is an adoption of physicians after working with an electronic medical record. So you can see that by the percentages, up here at 54%, compared to 86% when 11 or more physicians are in practice using that electronic medical record, so there is a high percentage. Insurance companies, we even have an HMO of up to 100%. So the percentages are quite high, above 60% of the physicians in favor of electronic medical records. So what are the advantages for the patient and the safety of the patient? The mechanisms of safety for an electronic medical record is one of the main elements that electronic medical record companies design into their computer software system. They are trying to come out with a program that is geared towards safety of the patient and safety of their information. There's a reduction of medical errors, representing a benefit to both the patient and the doctor. An electronic medical record reduces unwanted handwritten notes. How many times do the doctors write out a prescription? The patient tries to take that prescription to the pharmacy to fill it, and in the meantime, they've lost the prescription. So there's a definite advantage over that, where there's no more loss of paperwork. It's done click on point in the physician's office. The prescription is submitted electronically to the pharmacy. By the time the patient goes there to pick it up, it's ready to be picked up. Then, constraints can be placed upon a user to limit access to certain patient information. With me using Epic on the job, I am limited to what I can get into for certain patients. It's on a need-to-know basis to do your job. The training for users. Everyone needs to be updated, and it's very important to train staff so everyone is updated on the latest technology for medical records. Here we see one of our own employees at Upland Hills Health, and she is scanning electronic records, paper records, into a patient's chart. So, as you can see by this stack of paperwork here, these are documents that need to be scanned into the system, so they'll be there in the record. With every advantage comes the disadvantages of an electronic record. We can look at the privacy. We are all very concerned about our privacy because there's so many cases of identity theft. We don't want the wrong information to get in the wrong people's hands. So there's always that chance. Someone is going to get into your system. Even with all the firewalls, there's always that chance. And then, of course, there's the identity theft. Then there's a concern for all companies is data loss. If there were to be a storm or your computer were to crash, there is a need to have your system backed up and backed up off-site. So if a tornado were to come through and crash your computer system, at least it's backed up, possibly in another state. So the electronic records can be retrieved. Some key points that I'd like to go through with you is electronic medical records, when not properly secured, can facilitate identity theft. Training and support from your electronic medical records software developer will help staff to perform efficiently and boost productivity. Patient care will be enhanced because of the quick access to the computer record. And it's important to have a backup system in place in case there's server failure. So I'm going to ask you, which would you prefer? A paper chart or an electronic medical record?